Sir, we are live now.
Okay, thank you. Hello. Sir.
Hello.
বলুন।
Hello, good evening. I'm Dr. Boron from Shingur.
এক মিনিট।
Yes. সাউন্ড জায়গাটা কাটা লস হচ্ছে এইখানটা
না এটা ওদের ঠিক আছে। ভিডিও অডিও বলুন তো।
Hello,
Yes.
I am audible?
Yes, sir. Yes, sir.
अरे आवाज आ रहा है ना?
Yes, yes.
ओके थैंक यू थैंक यू। আমি করে দিচ্ছি আমি বলবেন না আমি করে দেবো। ফার্স্ট পেজ এটা আছে।
Okay, sir, I am going to start. I am Dr. from Shingur. I will discuss today the novel G-dose G protein vaccine in case of
কানেকশনটা কোথায় গেল?
in the treatment of rabies.
Sure, sir.
स्क्रीन आ रहा है ना पेज पे? देखिए तो।
नहीं 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 आएगा. Can I share?
টাওয়ারটা কিভাবে? টাওয়ারটা ঠিক রাখ, টাওয়ারটা কেটে যাচ্ছে তো।
এইটা ভিতরের জন্য হচ্ছে টাওয়ার ঠিক আছে
কানেকশনটা স্যার এখানে মনে প্রবলেম হচ্ছে।
বাইরে যাবে ওখানে
ওখানে কি ভালো
Sir,
আসছে?
hello, hello. Sir,
हाँ,
I have a
हाँ, बोलिए।
slides. I can share.
ओके एक मिनट में एक मिनट एक मिनट एक मिनट। ये पर कनेक्शन का थोड़ा ना प्रॉब्लम, अभी इंटीरियर बेल्ट है ना इधर, तो
Yes,
कनेक्शन का
yes.
थोड़ा प्रॉब्लम आ रहा है।
Okay, 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 sir.
কানেকশনটা আসছে?
এটার সঙ্গে এটা কানেকশন আছে
হুম
আমার ফোনের সঙ্গে এটা ল্যাপটপের কানেকশন আছে
सर जी थोड़ा स्लाइड शेयर कर देंगे? हेलो हेलो।
Yes, sir. I will share.
हाँ आप थोड़ा शेयर कर दीजिए। पीपीटी मेलটা खोल, पीपीटीটা खोल। हाँ सर এখান থেকে দেখে নিন। वीडियो ऑन है, वीडियो आ नहीं रहा है।
Yes, sir. Hello.
वीडियो आ नहीं रहा है।
नहीं आ रहा है वीडियो आ रहा है सर, मेरे में दिख रहा है।
दिख रहा है ना? ओके
फोन से
ठीक है
चलेगा,
ठीक है
फोन से।
फोन से चलेगा तो ओके ठीक है मैं कर दे रहा हूँ। अगर आप स्लाइड पूरा बोल दी हो गया। हेलो गुड इवनिंग এটা ও সবাই দেখতে পাচ্ছে।
Hello,
হুম।
I am audible.
হ্যালো
Yes, 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 sir.
Yeah,
Go ahead,
yeah.
go ahead.
Okay. I am doctor from Shingur. I will talk today about the role of G protein vaccine, 3-dose G protein vaccine in the role of rabies treatment. As you know, the rabies is a viral disease. It is caused by RNA virus known as the rabies virus. It is group of Lissa virus, and it is a globally it is involved about 59,000 death annually, and in India it is near about 20,000, about 60% in India. It is definitely a matter of think in today's world, in specifically in India. Okay, that's why we are worried about this, and to control this rabies in India uh, within the year of 2030, it is our challenge. That's why the research is going on, and Cadila, in this case, they have discovered a new vaccine that is a that is a rabies protein G vaccine 3-dose to curtail the duration from 31 to 7 days because of good compliances. Okay. And 91% death in India occurred in rural areas. And in Asia, it about 35% globally. So it is my privilege to give me the chance to talk about these vaccines. We are going ahead. The next, first of all, we know what is the disease rabies. It is caused by the virus, the rabies virus. When there is bite of any rabid animal like dog, cat, jackals, rodents, and also rabbits. The virus from the saliva of the animal goes to the superficial layer of the skin, the cut wound, from skin to the local tissues, and from the local tissue it goes to the local nerves, peripheral nerves. From the peripheral nerves, it goes through the nerves to the spinal cord, and through spinal cord it goes to brain. Actually, ultimately, the brain is involved and causes viral encephalitis, and because of viral encephalitis, and ultimately because of multi-organ failure and the neurological symptom, patient goes to death. And we know it is 100% fatal disease. If we don't take care of the disease in the first, as soon as possible, we can't control this disease. The 3 step is there to control this disease. The first one is the local wound treatment. We know the first aid. When there is any bites of animal, it may be 3 types, 3 category of wound. It may be category 1, 2, and 3. Category 1, there is only scratching, or there is no cut injury or any just touches the animal. But second one is a slight scratches and but no bleeding. And third one is there is a loss of skin continuity and bleeding also. This is a category 3. In case of category 1, this is a local wound treatment is the main treatment, and followed by vaccines. And category 2 is also same. In category 3, we need a local wound treatment followed by active passive immunization, that is a rabies immunoglobulin and followed by vaccines, the very cell culture vaccines, the kill vaccines. And according to WHO guidelines, there are 5 vaccines available throughout the world: 0, 1 to 21 days, 5 dose, 0, 3, 7, 14, and 28 days. Local wound treatment, we usually do when there is any bite of the animal. We first clean the wound by soap water, or where the soap is not available, only by water, and also other disinfectant, and also iodine 60%, and followed by passive immunization locally in case of category 3 by rabies immunoglobulin. And then from first day of injury or infection, we go through the vaccines, 5 doses of vaccines. This is followed throughout the world according to WHO guideline to control of rabies. The challenge is here that the current challenge for post-exposure prophylaxis is that non-compliances. Current rabies vaccines are cell culture vaccines. We know in the past days, you know, in the old days, there was a live attenuate vaccine also. At that time, near about 31 vaccines are required, 1 to 31 days, and it is reduced. Now it is 5 dose. And inactivated vaccines have greater than 50 years old technology, inconsistent potency, stability, availability, short supply, and adverse event. Compliances of anti-rabies vaccines: the complainant who received full dose of ARV, that is the scheduled dose of ARV on the recommended dates; delayed complaint, who complete the scheduled dose of ARV with 60 days but deviate from the scheduled regimen; and also dropout and in non-complaint who had taken at least 1 dose of ARV after animal bite but not completed all the scheduled doses. The rabies post-exposure prophylaxis in routine practice in view of new Center for Disease Control and Prevention and the World Health Organization recommendation. The limitation for 4-dose WHO recommendation. A retrospective analysis done at Travel Clinic, a total of 110 patients who received rabies 4-dose PAP post-exposure prophylaxis. Shortcoming in the management of these patients are the late intimation of the rabies PAP in travelers, and also administration of human rabies immunoglobulin and antibody level less than 0.5 international unit per ml in 6 to 90 patients, near about 6 to 7% after 4-dose vaccines. So the conclusion is that patients do not always receive optimal rabies PAP under real life conditions. A significant portion of patients didn't develop adequate antibody levels after 4 doses. This is the non-compliances of the PAP of older regimen. The non-compliance of 5-dose, naturally, we can see the proven cause of death is the neurological involvement. Suppose you can see in this slide that 58 years old female, 38 years old male, and 30% male, they got the injury from the street dogs. One is killed, dog is killed immediately, and other street dog, they are not found later on. All the patients are given 3 doses of vaccines, 037, but they have not come later on. So naturally, the antibody titer was not enough in the human body. That's why this succumbed to ultimately death because of development of rabies. And all developed initially first fever, altered sensorium, spasm, and ultimately because they with 1 to 16 days, they all goes to death because of multi-organ failure and viral encephalitis. The reason for death may be due to lack of administration of rabies immunoglobulin and poor compliance to vaccination. Actually, they are not given the passive immunization by the rabies immunoglobulin during the first day, during the time of first treatment, cleaning of wound, after cleaning the wound by water and soap, and also they are now completed the full course of PAP by seroculture or cell culture vaccines. The comprehensive to post-exposure prophylaxis among animal bite patients in a hospital-based epidemiology study at Safdarjung Hospital, New Delhi, near about 360 animal bite patients. A pre-designed, pre-tested structural questionnaire was administered by the interview technique. 53% were non-compliant to the full course of ARV. We can see the slide that the 46% non-compliant, compliant 48%, and delayed compliant 6%. Compliances to the anti-rabies vaccination in post-exposure prophylaxis. You can see 0, 3, 7, 14, and 28 days. We can see near about 28 days, 60%. A municipal corporation hospital, Bangalore, number 215 animal bite patients, 1 dose of rabies vaccine administered intramuscularly on day 0, 3, 7, 14, and 28 as PAP. Also measures constraints for compliances to complete course. At 28 days, we can see it is 60%. But initially, at the time of injury, the patients got compliances over 100%. But at 28 is 60%. The compliances rate for intramuscular rabies vaccination was 60%. Constraints for compliances to complete course of anti-rabies vaccine. Actually, by interface with the school timing, we know they're not able to go to the clinics to take the vaccines. Distance from the hospital, it may be far away from the hospital, and definitely cost in shops, medicine shops. It is private. It is very costly vaccines, and 18% they forgot about the dates when the vaccines to be taken again. And also 47% patients, they actually they think about their wages. If they go to the clinic and they give some time for treatment to clinics, they think that the whole day will be lost and they won't be able to do income money. That's why they think of wages of that day. That's why they avoid to go to clinic to take the vaccines. The major constraints of compliance to complete ARV was loss of wages, maximum 47%. Evolution of rabies vaccine to avoid these non-compliances, the evolution the Cadila Pharmaceuticals has they've discovered new vaccines. That is the evolution of the rabies vaccine. That is the protein G vaccines, the nervous tissue G protein, three dose G protein vaccines. We know evolution of rabies vaccine is the one 1885, then followed by 1911 and 1976. That time there was a dry preparation, and 1911 minimal neutral content liquid preparation, and 1970 followed standard immunogenicity lyophilized vaccines. And initially it was 31 injections followed by 14 injections, and now it is 5 injections, 0, 3, 7, 14, and 28. Non-compliances led to evolution in the treatment regime from 31 days to 5 doses, and still research is going on. Novel 3-dose recombinant rabies G protein vaccines, novel 3-dose recombinant G protein vaccines. It is a fast protein subunit vaccines prepared by VLP that is virus-like particle platform technology. First vaccine with 3-dose intramuscular regimen, 037 days given, and better compliance due to easy to flow regimen and less visit, and convenience, ready to use, no reconstitution needed. Novel 3-dose recombinant rabies G protein vaccines. What is VLP technology? It's virus-like particle. We know there's a native virus. This one is a native virus. And ultimately, it goes to VLP as the vaccines. First, the G protein is difficult to stabilize. G protein isolation using VLP technology, purified, stabilized by the Cadila pharmaceutical stabilizer. Actually, we see in the rabies virus, there are a lot of, in the surface, there is proteins like M protein, G protein, L proteins, and also RNA polymers. But all the protein is not immunogenic. Only the G protein and there is a N protein, they are immunogenic. So that's why G protein is isolated. Actually, it's very difficult to stabilize. And for here, G protein is isolation and purified and stabilized by pharmaceuticals by the VLP technology. The VLP is a similar native virus particle, but that do not contain the viral genome. Virus particles of protein complexes exist as a nanoparticle form. They can't replicate but mimic the viral antigenicity without being pathogenic. They are capable of inducing strong humoral and cellular immune response. And ultimately, VLP as a vaccines, it acts as a vaccines. In this slide, we can see the seroprotective protection data from day 14 to day 27. Three dose and 03 is 0 to 2 dose, and 03 and 037 3 dose. And we can compare day 14, 42, it is similar, but after 180 days, slightly reduction. But the G protein vaccination is always better than the Rabipur. Clinical study phase 3, the safety and immunogenicity of the novel 3-dose recombinant nanoparticle rabies G protein vaccine administered as stipulated post-exposure immunization, a randomized comparator and controlled and multi-center phase 3 clinical study. Phase 3 study to evaluate the immunogenicity and safety of rabies G protein vaccine administered as stipulated post-exposure immunization in healthy volunteers. Randomized comparative controlled and multi-center study, near about 800 patients, randomized 2:1 ratio. 3-dose rabies G protein vaccines, 037 patients, and Rabipur 037 1428. It is compared. Rabipur given to 67 patients, and 3-dose rabies vaccine given 533 patients. The results: efficacy, seroprotection. We can see 14 days protection on day and 42 days. These are 99.24%, and placebo is the 97, and 98.69 at 40, and it is 100% according to reference. The results are consistent across different age group and genders. Observed difference 1.52% with the 3 specified margin of 4%. It signifies the non-inferiority of seroprotection primary endpoint day 14 and 42 are met, and test and comparator are identical in seroprotection rate both in day 40 and 42. Safety, we can, if we compare the adverse event with a Rabipur, there is the adverse event is also less than the Rabipur, and local adverse event, it is also less than the Rabipur. And systemic adverse event, it is also less with the reference. 3-dose has better safety profile as significantly compared to reference vaccines because of significantly less adverse event. Study conclusion. 3-dose was non-inferior to reference vaccine, less adverse event compared to reference vaccine, and novel 3-dose was found to be safe and immunogenic and was comparable to 5-dose of WHO pre-qualified vaccines. Thank you. Thank you, everyone. Pharma Innovation of the Year by the Economic Times and Golden Globe Tiger Award Malaysia for the Innovative Product of the Year. These are two vaccines. The awards was given by the authority to Cadila Pharmaceuticals Limited. Thank you. Okay, we have concluded today's sessions. We have discussed about all about 3-dose novel rabies G protein vaccines and the good compliances because the dose is curtailed from 28 days to 5 days or 1 day, 1 week's regimen for better compliances. Thank you.
Tech support, you can stop recording.
Okay.